A stark illustration of the new number of COVID deaths in the United States, 700,000. From the White House.
That is a striking, horrifying number of lives lost.
But now, new hope. A pill that drug company Merck says prevents the coronavirus from multiplying. So promising that the clinical trials were stopped early, so more lives could be saved. Taken at the onset of the disease, the pill reduces the risk of hospitalization or death by half.
They could go to their pharmacy and take their medication the way they do other medicines. This would allow us to treat many more people much more quickly, and we trust much less expensively.
Dr. Caleb Hernandez is an emergency room doctor who also researches COVID drug discoveries. He says 3 other pills have been introduced, one that reduces the need for oxygen by 3-fold, but not under big pharmaceutical names. So they sit on a shelf without the money for FDA approval.
Our government isn't set up to spend the $500,000 to do these studies. We rely on private companies to bring things to the FDA. And that's why you're not going to see as much innovation as you could see.
Experts worry that Americans will rely more on this new pill and avoid vaccines that teach the body to make its own coronavirus antibodies. But for remote countries, pills may be easier to administer. Affordability and distribution are other factors, though. Hernandez hopes that some drug, any drug, will end the pandemic.
But all I can think about is seeing that look on your face.
He sings this tribute to a fellow doctor who quit the profession because he was burned out from COVID.
We've been going for almost 2 years now, fighting every day, watching people die. And I think it's difficult when people in the community don't believe you. They think that you're part of some conspiracy or you're exaggerating or making things up. And then you go to work and you have to pronounce multiple people dead.
Merck plans to seek approval for emergency use of the drug, which could take about 2 months. Carolyn Presutti, VOA News.